Hello, listeners. Welcome to Views on Health. On the program tonight is Professor Hasini Banneheka, who is a Vice President of the Sri Lanka Medical Association. And as most listeners will know, it's the premier body of medical professionals in Sri Lanka. And Professor Hasini Banneheka has played a crucial role in the recently concluded annual Congress of the Sri Lanka Medical Association. And apart from that, she is also professor in parasitology, but currently attached to the Cardiff University in Wales and the North Wales Medical School in Bangor in Wales. A warm welcome to our studio, Professor, and it's a pleasure to have you with us on the program.
Hello everyone. Thank you, Mrs. Fatima, for inviting me for this program, and welcome to, I would like to say welcome to everyone listening right now.
Thank you, and we are going to focus on medical education, which is a passion with Professor Hasini Banneheka. Medical education, what is it? I must say that maybe about 3 years ago, we did speak on this topic with yet another professor in Sri Lanka, actually Professor Indika Karunatilaka. And now, 3 years since then, many advances have been made in medical education. And as to exactly what it is, why is it called medical education? Who are you trying to educate? And what is the purpose? And what are the goals? And what does one want to achieve? These are important factors to be taken into consideration. So without any further ado, over to you, Professor, to introduce the topic.
Right. Thank you so much again. When it comes to medical education, actually we are targeting those who are teaching the medical students. Now, earlier days, if you take when we started medical schools in Sri Lanka, those days, generally what happens is the doctors who are working in the curative sector, that is in the hospital sector, they were requested or invited to join the faculties to teach medical students, and they shared their experience and knowledge with the students. But gradually medical education emerged as a separate entity, so that since then they started developing how students can be educated better. Like previously it was like a gut feeling, or you do the way you have been taught by your own teachers, or you try to sort of develop your own philosophy of teaching and then do accordingly. But with this development of medical education subject, actually what happened was they started looking into how the students learn. Now, previously when I was a medical student, how I learned it was rather teacher centered. So the teacher decided how to teach, and they taught us the way they have been taught by their own teachers. So it was, this was a major drastic change from that teacher-centered medical education to student-centered education nowadays. So now, of course, the focus is on the student, so that we are looking at the student, how they would like to learn, and how will they learn better. We are thinking of those lines when we talk about medical education. So since we all come from, now if you take the medical school, there are at least 14 subjects or more in some schools. So based on that, we are specialized in different subjects. So we come together and for a common purpose of teaching the students. Now when we get the students, actually they are very naive, immature, basically those who have came from the school. Mostly they have been it's not the correct word, like spoon-fed, like they have been taught in a very in a way that the teacher has taught and the student has grasped that, and then they have they are trying to sort of get that knowledge. But when it comes to university, there is a drastic change where the student has to be independent. They have to take the responsibility for their own learning. So for that, of course, we need to prepare the teachers as well.
Thank you so much for that lucid explanation to what medical education means, and about you're saying that it is a change, quite a leap, I would say, from what it used to be to what is the focus right now. So obviously, everything in the world is advancing. So as much as so many fields in medicine have advanced, I'm sure this is something very crucial, because you are now introducing something different to the students who want to be doctors in the future. I'm wondering if this is a bit premature to bring it up, Professor, but apart from medical students, now we have the A-level students in schools who are concentrating on bio because they want to enter the field of medicine. So would you say that this should even extend to them in some way to make them realize that if you want to do medicine, you've got to sort of, progress in this manner, part of medical education? Would you say that?
It depends on which type of exams they are going to sit for to get entrance to medicine, I would say, because as you are aware, in Sri Lanka, majority of the students sit for local A-levels, as we all did in the past. But as you know, with this recent COVID post-pandemic era, most of the students, previously also there were a portion of students sitting for London A-levels and other international exams. But nowadays, of course, there is a major portion of, not major, some higher percentage of students are sitting for other international exams as well. So since I have experienced both sides of the story, because I have done my local exams and then I would say my kids did international exams, so I know the both sides of the story. To say that mostly the international, they are thinking of application of knowledge, whereas still we are thinking of more of checking the knowledge in our exams when it comes to school exams. But I think we have started, I have to say, most of the teachers now, they are interested in learning how to teach. So even the school teachers nowadays, they are getting qualifications in education apart from whatever the subject they are, like us in the medical school. Even the school teachers I have seen, they are doing masters in education and so on and so forth, so which means they are also interested to know how to teach better to the students. I think that is getting seeped into the system slowly. I mean, changes happen gradually, so I'm actually looking forward, and I'm quite positively or hopefully waiting for that transition to happen. But it will happen. It's happening right now as well, to my knowledge and to my understanding. So I think that's a good shift of thinking, I would say.
So would you say that medical education is not confined to doctors to be? Would it be extended to other medical staff? There are nurses, there are paramedics, there are physiotherapists. I mean, there are a whole range of sub-disciplines that lead to medicine or branch off from medicine. So would you say all of them should be encompassed in this process of medical education?
In fact, now earlier days also there was this postgraduate in education. So medical education was part of it, I would say. Later on it branched out to be more specific towards medicine, because education postgraduates were there, and most of these teachers and most of the educationists in this country have done those exams, PhDs and masters in those educations. What's the difference between medical education? That education is the principle is the same, but in medicine there are a lot of other things other than, there is major practical aspect to it, because we are teaching skills to the doctors. Knowledge is something that you can actually gain from reading a book, because I said we expect the medical students to be autonomic, so which means they need to read, they have to look for the resources, they have to learn on their own certain knowledge. But when it comes to the skills, some of the things they have to observe their own teachers, that means the consultants in the ward, and learn. And some of the other things we teach them, we demonstrate them to learn. So there is a apart from the other subjects, there is a major difference between subjects like medicine and even other subjects where the practical part is involved in, like engineering to my knowledge. So that's the difference. When it comes to other health sciences, now when I did postgraduate in medical education, my batchmates included some of the health sciences tutors as well, so they were also following the same course as us. Of course, after the certificate level, they have to deviate from the medical education, because medical education is per se, it is more concentrated on medicine per se. But the others are also doing, and most of the, apart from their own subject, they are all doing other subjects as well nowadays.
Thank you, Professor. So how does one proceed in this respect? How do you disseminate what you want to disseminate to your target audience, that is basically the doctors to be?
Right. If you're thinking of how we teach our students, as I said, now we are doing student-centered education. That means we are thinking how the student would like to learn. In that aspect, for example, now since we were talking about the 137th anniversary medical congress that we recently had, organized by the Sri Lanka Medical Association, where I was the academic chair and the vice president, there we had a session which was about technology enhanced medical education. So in that we tried to think, now the concept is, nowadays the students actually, the younger generation, we call Gen Z, or they are very tech savvy, so they like to use technology to learning, and they are always with the technology. So the technology enhanced medical education, the concept is that we need to target how they would like to learn, and using technology means we can actually use technology to enhance their learning. That is what we did.
Thank you, Professor. Now, when you speak of technology, how much can we apply it here in Sri Lanka?
Right. Now, when we go to other part of the world, other side of the world, the northern globe, we think we cannot do, we are worried about adopting those technologies here. But I would say we don't have to take the entire thing. We should be able to do certain things here, because some of the things are doable, I would say. We just need to find ways of doing it and adopting it to the country situation. We can contextualize all those systems. Some of the things we can actually do. For example, I would say in the UK medical school that I work, we do all computer-based exams. That means, even in the medical school that I worked in Sri Lanka, we wanted to do, but there was little reluctancy, or there was little anxiety over doing online exams, not online, computer-based exams, because they thought it can lead to cheating and students can cheat and so on and so forth. But to be honest, what I realized was the software that we use in UK is a free software, so it doesn't cost anything, and the students are given their own devices to do. They think by doing that, students are more comfortable. There is no anxiety part coming in and intervening with their performances, and they think by using their own devices, students are more familiar. Even the keyboard, they are very familiar, so they use their own devices, but there is a system to lock them inside the device so that they cannot actually get out of it without we, the invigilators and the supervisors, not knowing. So they get locked in and they do the exam within that locked system, so they cannot actually access, in which case it is more secure than how we do in Sri Lanka, where we print the papers, which is a costly affair, and then to print the papers now as the even senior lecturer or professor or the head of the department has to be there when the papers are printed, and then they have to be securely stored so that it doesn't get into anyone's hands. So there is a process which takes a lot of human resources as well as other resources like paper printing and it's a kind of waste where we can easily do. We don't need special equipments. every student nowadays has their own device. Those who don't have own devices, we give the computer lab and set that software so that they get locked inside the system and they cannot actually cheat. Because if we now, Fatima, you and I are seated next to each other and doing the exam, we are doing the same paper, but your question number 1 and my question number are totally different. Your question number 2 and mine are totally different. It's jumbled up so that we cannot even discuss, even if there is no supervisor or invigilator looking at you. So that's those things actually we can easily contextualize to our country, and we can adopt those. That's why I was trying to teach the Sri Lankan community during this Congress that these are doable things. Of course, there are other things that we talked about at the Congress, like there is a new way of teaching anatomy in Sri Lanka. We teach using human cadavers. We dissect them as a student I did. So that is by cadaveric dissection we teach anatomy. But some of the countries nowadays, they are doing it in using a technology. It's like dissecting a person on the computer table. So those things we may not be able to adopt due to the high cost, but there are other things which we actually can learn from them and then contextualize to our country, and from there we can go ahead and do. Because at the end of the day, our students will also compete with them for various things. Say for postgraduates, we all of us who are consultants in this country have gone to some country for foreign training. So during that time, we all work with the other rest of the world doctors. So which means we have to be in par with them to work with them. So we need to be up to date in our knowledge as well as skills. We have to be somewhat familiar with all the settings to a certain degree. So I think we can learn from others a lot of things and contextualize to suit our education system and economy. It's not that it cannot be done. It's doable in my view.
Wonderful, because it's a positive approach towards accepting change or going for something better or something more innovative will take you somewhere. You can move forward. So at the Congress, when you highlighted all these factors, how receptive was your target audience or your audience at that point in time?
Actually, they were really interested. There was, a lot of were very inquisitive about anatomage, that is actually the dissecting table, the digitalized dissecting table. But apart from that, when we admit about this other thing, that is secure exams doing computer-based exams, they were asking, and they were taking, they were asking questions from me also as well later on. So I think they are all thinking about it. How to do it. And some of the other things, some of the facilities are actually, we do have some of the facilities, but it's just that we haven't started using them effectively, I would say. Some of the things similar to anatomage functions, there are other softwares which we use in Sri Lanka, but they are not being used 100%, I would say.
So getting back to medical education and what you want to focus for the benefit of our listeners, amongst who are medical students and other professionals, medical professionals as well. So based on that, Professor, can I ask you, just digressing for a moment, if we have any students want to pursue medical education in a foreign country, of course they have to spend. Putting that aside, if they're able to do so, what would you advise them to do?
Right. I think you're talking about A-level students wanting to do medicine. So I mean, the reality is we don't have enough seats for everyone who are interested in doing medicine. So some part of them will have to go overseas to do medicine. As far as I am concerned, as a teacher in medical education for 23 years, as well as somebody who is doing medical education as a postgraduate, as well as a parent and a normal person in this country, I would say the first thing is you need to have liking to do this. Because we see students who are coming to medical schools just because the parents have told them, and they don't like it at all, and they go through various psychological issues because they are doing something that they don't like at all. So first thing is they should like it, I suppose. It should come from the child, not from the parents. I know traditionally we think all professional jobs are better in our setup, but it's not so anymore. Kids know better than actually parents. They know the opportunities the world has, the amount of different type of careers that there are existing in the world. So children actually would like to explore them, and they find various lateral the way outs of doing better than doing medicine. So the first thing is, I think they should like it. Unless they like it, we should not force them. If they like it, if they want to do medicine, we have to know it's a tough course. It's a very major commitment because you're learning it for at least minimum of 5 years. Some medical schools in overseas, they have 6 years, 6.5 years as well. I think some of the other countries like US, they have to do a basic degree and then get into medicine. Even countries like Philippines, they have to do a basic degree and then it's a graduate entry medicine that they do. Even in UK, there are medical schools which has, even in Australia, they have graduate entry. So not everyone can go to any medical school in the world. First thing is, they always look at the results. So if you're targeting to get into medicine, if the child actually likes this subject, they should start working early so that they get good results, because UK medical schools, you are not given second chances. Like in Sri Lanka, you can do second and third try to get into medicine, but in UK they look at your first try results only, so that you cannot get into unless you do a graduate entry there, as you do a first degree and then enter. So the first thing is you liking it and then performing at the university entrance exam and getting good results. And apart from that, most of the medical school, not in Sri Lanka, the overseas, they have an interview. It can take the form of just a viva, or there is something called multiple mini interview, where they have to face several mini interviews, series of mini interviews. That is one way. And they have to write a personal statement to show their commitment, and also they have to show how committed or how sort of what have they done before even starting, like whether they have done volunteering, whether they have done some kind of health related things. So there are a lot of things. It differ from country to country, but the first thing I would say, the student should like it to do it. Otherwise, because it's a tough course, because it needs a lot of commitment and you have to work hard every time you have exams, and there is no easy subject in medicine. Every subject that we do from first year to final year is different and difficult. But if you enjoy something, you put yourself 100% dedication, right? So in that way, I think first thing is liking it and then getting through the exam with flying colors to get into.
Thank you, Professor. So time is catching up with us. I'd like to ask you before we wind up, what sort of recommendations would you make to further medical education in Sri Lanka?
I would think, when we teach medical students, now from previous era, we tried to teach how we want the students to learn. Nowadays, it is about student. So because it is student centered, we now we are looking at the other perspective and seeing how the student would like to learn. So I think whether we have done postgraduates in medical education or not, every teacher in medicine, medical schools, I think it's good to at least do a short course in medical education to which teaches us about education philosophies and all these methods. It's one of the good things we all should do. And the other thing is, we have to understand the students. They are not in the same era or the they are coming from a different generation. We need to understand them, then only they will start liking our teaching.
Thank you so much. And on that note, we end this interesting discussion on medical education. Thank you very much to you, Professor Hasini Banneheka, Vice President of the Sri Lanka Medical Association and Professor in Parasitology, currently attached to the Cardiff University in Wales and North Wales Medical School in Bangor, also in Wales. Thank you so much for sparing your valuable time to be with us on the program. We really appreciate it.
Thank you so much. Thank you, Fatima, for inviting me, as well as thank you so much, the listeners, for your valuable time.
Thank you too once again, and my thanks also go to Piyumi Idrisinger for technical assistance. I'm Fatima Razi Kada saying good night and looking forward to your company next Monday same time on Views on Health.